Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're discussing hepatic cirrhosis, a chronic, progressive liver disease characterized by fibrosis and nodule formation. Cirrhosis can silently develop over years, leading to life-threatening complications if untreated. To help us understand what causes it, how it's treated, and what's on the horizon, I'm joined by my friend and colleague, Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine for many, many years. Dr. Henderson, thank you for joining us.
Well, thank you for having me.
So, let's tell our listeners what exactly is hepatic cirrhosis.
Okay. Well, cirrhosis is the result of a long-term damage to the liver. Actually, it's liver scarring. And healthy liver tissue is gradually replaced by scar tissue, which disrupts normal blood flow and liver function. This scarring is the liver's response to chronic injury from causes like viral hepatitis, alcohol use, even non-alcoholic fatty liver disease or autoimmune diseases can cause cirrhosis.
Well, how does genetics play a role?
Well, certain genetic conditions can directly cause or predispose someone to cirrhosis. Genetic variations can also influence how the liver processes toxins or responds to inflammation, increasing susceptibility.
So, in early development, it starts?
Oh, the liver starts forming early in the womb, arising from a germal layer. Disruptions during the fetal liver development, whether from genetic, nutritional, or toxic, alters the liver structure or elasticity, potentially making the organ more vulnerable to injury later in life.
So, what symptoms should one look out for?
Well, early cirrhosis is often silent. As it progresses, however, the symptoms include fatigue, jaundice, that's yellowing, and easy bruising, sometimes abdominal swelling from what they call ascites. And then there's confusion from the hepatic encephalopathies, that's illnesses in your brain. And of course, there's gastrointestinal complications, which is usually bleeding from varices, which is a fancy word for saying varicose veins. So some patients also notice muscle wasting because they're so weak, and itching. Itching is a dominant symptom.
Well, let's talk about that itching because a lot of people come in and they'll say, they won't say any of the other things. They just go, Doctor, I'm just itching. So, should we focus on the liver?
Oh, for sure. I think itching or pruritus is a common and distressing symptom for people with liver cirrhosis. It affects over 70% of patients. It can occur even before other symptoms of cirrhosis appear or become apparent. The itching is thought to be caused by a buildup of bile salts and other substances in the body due to impaired bile flow.
All right. So now, how is cirrhosis diagnosed?
Diagnosis involves a combination of medical history and physical exam, of course, lab tests to assess liver function, and imaging like ultrasound or elastography to evaluate scarring. And sometimes a liver biopsy is necessary to confirm the extent of fibrosis.
All right. So someone now has had all the lab work, the ultrasounds, the this, the that, and the doctor says, unfortunately, either you are about to have cirrhosis or you have cirrhosis or you have really bad cirrhosis. So let's talk treatment for those different stages of cirrhosis.
Well, the conventional treatment aims to manage the underlying cause, preventing further damage and treat the complications. This may include antiviral medicines for hepatitis, alcohol cessation for anybody drinking too much alcohol, and medications to control portal hypertension. That's the blood pressure between the kidney and the liver. Endoscopic treatment of varices, those are the varicose veins that are now in the bottom of your esophagus instead of your ankles. And the use of diuretics for ascites.
All right, let's talk traditional Chinese medicine. What can that do to help cirrhosis?
Well, in traditional Chinese medicine, cirrhosis is often linked to patterns. There's herbal formulas, acupuncture, and dietary adjustments that are aimed to improve circulation, reduce inflammation, and support the digestive and hepatic function. Some of the traditional strategies are being studied for their potential to modulate gut microbiome and immune responses.
And now for your area of expertise, regenerative medicine.
Well, regenerative cell therapies are being investigated and are used anytime the body needs new cells. So in this instance, it's the body's ability to reduce inflammation and reverse fibrosis and stimulate hepatic regeneration. Exosome therapy is also showing significant promise in reducing liver scarring and modulating immune responses. Peptides and platelet-rich plasma, PRP, are being explored for enhancing vascular remodeling and tissue repair.
We know everybody knows someone or someone who knows someone that had to have a liver transplant because they were gone. So is it possible to use regenerative medicine as you know it now and could help our audience understand it, that someone does not have to have a liver transplant if they are at the end stage of cirrhosis is so bad, there's no hope?
Excellent question. Depends upon the stage. What you identified is absolutely correct. We've reversed many, many patients from requiring a liver transplant. I'm not so sure we know exactly how far gone that liver was, how much scarring there was. But there is no question that you can, like the liver does, the liver regenerates part of its cells itself. So you're not starting at ground zero. You're starting a little up the ladder in terms of making new cells. So what we do is enhance them with peptides and exosomes before we add the various types of regenerative cells. And they include stem cells. We always ask them to stop drinking because that can contribute to worsening of the cirrhosis. They have to have healthy weight, control their sugar, and eat a low sodium diet. They also have to stay active with moderate exercise, avoiding unnecessary medications or supplements, since most things are broken down in the liver and excreted in the kidney. Vaccination against hepatitis A and B are also very important.
Okay, so I want to talk about liver enzymes. Now, most people listening don't know that doctors are looking. When we do a comprehensive panel, let's say you go in and the doctor says, when was the last time you did blood work? And the patient says, it's been 2-3 years. And the doctor says, okay, let's do a whole panel. And we do something that includes liver enzymes. I want to talk about the levels of liver enzymes that just jump out to a doctor and says, we've got a problem, whether it's alcoholic cirrhosis or non-alcoholic fatty liver. Talk about those liver enzymes because the patient is handed their labs.
No question. Those are all part of a CMP, complete metabolic panel, and it includes at least 4, sometimes 5 aspects of liver function. And those 5 aspects contain the liver function tests. And so the liver enzymes specifically, ALT and AST, indicate liver damage or disease. The degree of elevation can provide clues about severity, and that's what we need. The ALT levels above 33 in males and 25 in females are considered elevated, while the AST levels above 40 can be concerning, with levels above 1,000 indicating significant injury. The specific numerical values and patterns of elevation are interpreted by a healthcare professional in the context of the patient's overall health and well-being.
Okay. So, what's the outlook for people with cirrhosis?
The prognosis depends on whether the disease is compensated for or decompensated. That's fancy for saying how soon did we catch it, really. With early detection and lifestyle changes, the treatments are very effective as long as you address the underlying cause. Many patients can have a slow progression. Decompensated cirrhosis requires closer monitoring and may necessitate liver transplant if you are not near a regenerative practice.
All right, I want to talk about something else. Lately, I am having patients that are 16, 17, and 18 years old with abnormal liver enzymes. They're very high. I know it's non-alcoholic fatty liver, but what do you think this horrible trend is happening? Why is this happening to our young folk?
I think elevated LFTs in younger patients can easily be due to medications and things or drugs, but some of it's genetic. Some of it, when you have elevated liver enzymes, it can be due to a whole host of things that we're responsible for. It looks as if it's often linked or influenced by physical activity and stress. Stress, besides the substance abuse, drugs I talked about, it can easily increase LFTs, liver function tests.
All right, let's talk about your mnemonic for cirrhosis care.
Well, that's the word liver.
All right, L stands for?
Limit alcohol and liver toxic substances.
I.
Identify and treat the underlying cause.
V.
Vigilant screening for complications like varices and cancer.
E.
Ensure adequate nutrition and exercise.
R.
Regular follow-up with liver function monitoring.
Thank you, Dr. Henderson, for helping us understand hepatic cirrhosis and the hope that is emerging with therapies for our patients. If you or someone you love has cirrhosis or abnormal liver enzymes, remember that medical care, lifestyle choices, and advancing research are making a real difference. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.